integration concepts and improvement in our lobby. So we are going to record. So if you do have questions or concerns, you can always pop it. Okay, so everybody should be able to see my screen here. Hey, welcome back. Sorry, guys, I apologize. We had a little bit of it wouldn't load for me very well, so I do apologize. So let's get started here. So you should be able to see the Functional Instrument Assisted Soft Tissue Mobilization webinar. So today we're going to focus on movement and mobility and teach you guys how to actually incorporate this into what you're already doing. Some of the basics about instrument assisted soft tissue mobilization that you as practitioners and trainers can use right away. So let's dive right into this. So let's go the M2T-Blade.com. So we developed what's called the M2T-Blade, which means myofascial mobility tool. So our goal is to always create mobility within the myofascial system. We also have a tape called bigger Kinetic tape. We're the only one of the only companies that actually puts your custom logo on that tape as well. Our primary goals, we develop course on proper utilization of the M2T, corrective and mobility exercise selection, and integration into practice. Our courses are primarily for trainers, therapists, students, and doctors. So I'm just gonna make sure that we're actually recording this here so we can send this out. We've had a little bit of an internet glitch, a little bit of a storm coming through here on a Good Friday. So today's webinar, so we're gonna have a lot to discuss and lots, and that's why we recorded so you guys can go back and watch them. And I know there's a ton of information that we do want, and our goal is to give you guys one tidbit or one thing that you can take out of this webinar and apply it to your practice and get better results with your patients. So first thing we'll talk about is about instrument-assisted soft tissue mobilization. Then we'll go into our theory, principles, and how it can help your practice. So if you haven't heard of our stuff or haven't seen it done before, just give you a couple of results that these are just screen grabs or screenshots that we took right off of Instagram here. So this is one of our high-end CrossFit athletes that's getting instrument-assisted soft tissue mobilization, mostly for therapy and recovery to help her improve. This is one of my favorite tests here. So this is our shoulder mobility test we see with our athletes. So this is on the left-hand side, this is before. On the right-hand side, this is after, within one treatment or within the same treatment. So this is a quick test that we do to assess the mobility of the shoulders. Then you can determine what muscles and what tissues to work on and apply it and then get these great results. Here's another one is one of our Ironman athletes. And these are just, you can see they're just screen grabs right off Instagram. So on the left is going to be before what's called the straight leg raise test. So this is just working on glute med, glute max, hamstring, and gastroc to improve that mobility. You see is a true Ironman athlete with that crazy tan line. This is Phil Younghusband. He's actually a huge soccer player over in Asia, on the top, the Beckham of soccer, or in Asia, I should say. Here's another before and after by one of our master practitioners, Kimmy. So this is on the left, you'll see the shoulder mobility test, and on the right, you'll see the same shoulder mobility test. And it goes from about 4 fists in between the two shoulders to about 1 fist in between the two shoulders. Now we are going to have a little bit of a bonus afterwards, but I want to focus on more delivering you guys content versus having a sell. So a couple of points here that please ask questions. During the webinar, I may not be able to get to all the questions, and I do try to spend a few minutes afterwards to answer those questions. So put in a little chat box right beside it, and we'll get back to it. You will get a recording, so if you do miss anything, don't worry about it. We will upload this up to YouTube so you can rewatch it and record it and do all that kind of stuff and have fun. This is a education webinar. So again, today it's Good Friday. Most people are not seeing patients or are off today. So have fun, enjoy, and just learn stuff. So we do have a new online virtual program. So with that online virtual program, you get $100 off plus a free additional kinesiology tape. If you do want to take advantage of that, you can always email us at education@m2tblade.com. So before we treat, we must properly assess. So again, our whole paradigm with the M2T-Blade is you always want to create a proper treatment program based on your assessment. So we're not going to go through the entire assessment. Today we're going to go just kind of an overview of what's to look for and what to actually look at. So before we treat tissue, we must properly assess. And here's a little bit of a paradigm here. So the 3 steps that we follow is we always start with dynamic movement testing. Doesn't matter if it's your first assessment or if it's your 16th assessment. Always want to go through basic foundations, just like squatting, lunging, push-ups, to see what's restricted. Because again, our whole goal and our whole basis is find what's not moving and make it move. So find what tissues is restricted and make it move better. Once you go through your dynamic movement assessment, we move into our treatment, which includes kinesiology taping and the M2T-Blade. Once you're done your treatment and instrument assisted work, you want to go into your correctives. We always believe to reinforce and turn on those neural pathways to re-educate the body of how to actually properly move. So we do, in this webinar today, we will talk about a couple of the correctives that we follow called isometric agonist antagonist retraining to put after you do the instrument work. So first is the assessment. So assessment should be the cornerstone of any kind of treatment program design. So we should never just go into it right into treatment. We always want to assess, treat, reassess. The treatment program should not be based on one's capabilities, not just their dysfunctions and limitations. As a program, we always want to start from global to specific. So if somebody walks into your office, we want to go and they say they have a shoulder pain, we want to look at the entire body because the entire body can be affected from their lower back to their knees. We want to find out what's not moving and make it move better. All those little issues can build up to a greater issue. So we want to make sure the body moves as an entire sequence and moving together versus just finding and treating the joint in question. Second is going to be treatment. So again, our goal for treatment is to retrain the movement pattern. So again, find out what's not moving and make it move better. This last point here is probably the most important point of this entire webinar. It's our basis of how we follow our M2T-Blade training program. So it says mobility, stability, strength, and movement pattern. So step 1 is once you determine your assessment, you find out what's not moving and make it move better. Our goal is to create mobility, and then once we create mobility, we want to move into stability. So when I say that, if someone has a knee issue, they have too much movement and stuff going on at their knee, you don't want to treat the knee. You want to treat what's causing that extra mobility. So in most times, if I have an ankle that's adhesed or I have a hip that's adhesed, meaning it's not moving very well, my knee needs to increase the range of motion and move more to make up for the lack of range of motion at the ankle and at the hip. That's just a human, that's just a basic human trait. We always try to compensate around our issues. So again, if you follow this program, patient comes in with a knee issue, we're going to start at the ankle, improve the mobility of the ankle, so improve the Achilles tendon, gastroc, the retinaculum in the front of the ankle, and the tibialis anterior. Once we improve those mobilities, we're going to work into the stability. Stability, so the knee will be this joint of stability. Once we do that, we go into strength, so strengthening those muscles that have maybe turned off and not fully functional. And then we're going to move into our movement pattern. So we train the body how to actually move, how to walk, how to squat, and how to lunge. In our case, we're always going to start with soft tissue, move the joint, and then we're going to kinesiology tape. So we're going to go through here. So, and last is going to be our corrective exercise. So whenever we do, whenever we do any kind of soft tissue release, we're always going to follow with corrective exercise program. Because our body is lazy, it's going to revert back to its most comfortable position, even if it's causing pain and dysfunction. So we need to retrain the body how to move properly to help reinforce those movement patterns. So corrective techniques will be determined from the assessment and to reinforce our treatment. This can include foam rolling, strengthening movement patterns, various flexibility techniques, and agonist antagonist retraining. So what is mobility? So, excuse me. So mobility is the ability to move freely without limitations to normal range of motion. Like we talked about, you have the knee with the ankle and the hip. If I have a painful knee with too much motion, we have too much inflammation, we're going to look at the ankle and the hip. So we're going to be adhesed at the ankle and be adhesed at the hip, which can cause that mobility at, or that those issues at the knee. So how many of us have restricted mobility? So almost all of us have some sort of imbalance, dysfunction, or mobility issue. So again, even if you have a client that comes in that says they don't have any pain or dysfunction, you can always take them through the steps that we introduce in our live course, how to actually assess those steps, improve the mobility, actually get a better movement and better feeling. You don't know how good you feel until you feel great. So again, someone may not know that they're feeling bad until you make them feel better. It's also about prevention too. This is not just about treating injuries. Treating injuries is kind of like the last standing. You also want to prevent injuries and help someone move better in everyday life and situations. So this protocol can not just be for injuries, it can be also for that sports performance, can be for improving everyday life and moving on. So mobility for stability, we want to create a mobile pattern before we stabilize it. So again, this is our kind of entire myofascial mobility. We always want to find out, so again, we want to find out what's not moving and make it move better. We make it move better with our blade. And we'll talk about that in a few slides about how to actually integrate that and put that into your programs. So that slide was, sorry, that slide was just a duplicate. So our goal with assessment. So on the left-hand side here is the paradigm that we want to follow. We want to spend a lot of time assessing. So we're always assessing, treating, and reassessing. We want to spend a little bit of time treating and small point of time correctives. If you look at the right side, most practitioners that treat or trainers that follow their stuff, this is the paradigm they typically follow and they don't get the greatest results. So spend a little bit of time assessing, a little bit of time correcting, and they're treating. So they're way over treating. They're constantly beating up the tissues, trying to create mobility, which actually can have a negative effect because if you work on the wrong stuff, it's not going to create a positive outcome for your clients. So we talked a little bit about kinetic chains of how the knee works with the ankle and the hip. We're going to move on to that as well. So we're just going to review those kinetic chains of how that we want to find out what's not moving and make it move better. So typical kinetic chains is how one part of the body is affected by another. So if I have a patient that has low back pain, we're going to see that their hips are going to be tight, their core is going to be sloppy. So when we say sloppy, it's going to be tight and weak. And then the thoracic spine is going to be tight. So if I, like we've probably talked about this one 3 or 4 times already in this webinar. So if I have knee pain, or if a patient experiences knee pain, look at their ankles. So their ankles are going to be tight, their low back / knees are going to be sloppy, and their LPHC, which is their lumbar-pelvic hip complex, is going to be tight as well. And the last one is that going to be our shoulder and neck pain. So the pec's going to be tight, shoulder's going to be sloppy, and the scapula is going to be tight. So what we follow is that we want to do what's called dynamic movement testing. This is going to be part of our assessment. So again, it's quick 7 exercises to go through that to find out what's going on. So we're going to try to help identify what kind of change we just talked about above and find out what's adhesive and what's not moving very well. So with our dynamic movement testing, it's 7 tests that form predicts function. You see what moves and put the body under a little bit of stress. Now, it doesn't matter if you are 85 years old or you're 12 years old, these tests can apply to everybody. And again, it doesn't matter, this doesn't need to be athletes, it doesn't need to be weightlifters, people that work out consistently. These tests, for example, the squat is one of the tests that we look at and that we break down. Everyday life is that you need to squat. If you're going to the bathroom, sitting in your car, sitting in a chair like you are right now, it's impossible to get into those patterns without squatting. So your patient needs to move properly in everyday situations. The biggest example I give as well is walking up the stairs. When I walk up the stairs, I need to go through that squatting motion, which is hip flexion, knee flexion. Again, I'm going to bring my knee to my chest to walk up the stairs. If we assess the squat, so we can help someone that has, say, everyday knee, ankle, hip pain walking up the stairs improve. So you can see what tissues are not moving very well, what tissues are under too much tension, and alleviate those structures from being underneath constant pressure. So again, we're not going to go through the test today. We do have a virtual program you guys can jump into. Our first enrollment starts next Friday. So it's really hard just to, on a webinar just to break down every exercise here. But again, mobility before stability. In order for the appropriate receptive system and motor control system to work properly, when something is stiff, something has to compensate to make up for that stiffness. Like we talked about, and this is the easy example we want to talk about, is the knee joint. So my ankle is adhesed, my hip is adhesed, and I have too much mobility at that hinge joint. Once I go through my 7 tests, I find out what's not moving and what's stuck. I'm going to go into my muscle testing and my range of motion. There's 4 types of muscle testing that we can do. So there's neurological muscle testing, there's joint, muscle, and chemical. So we're typically going to stick on the muscle joint when we're doing our stuff. So we also want to see what the body works as a one system unit, but we also want to break down those movements and find out what's the actual ligament chains not moving very well. So we talked about muscle testing. If you do our live course, you do our virtual learning experience, we go through every single muscle test it, treat it, retest it. So muscle testing outline. So there's lots of muscle testing out there. We kind of combine a few of them in our programs here. There's a ton of great books. If you ever want to learn more about muscle testing, just shoot us a quick email at education@m2T-Blade.com and we can send you out one of those. That's what we suggest muscle testing wise. So with our muscle testing, we always want to put the muscle underneath force and then see where that muscle actually breaks. When we put underneath force, we're going to put it into the short position and apply force for 5 to 7 or 3 to 5 seconds, see where that muscle breaks, that muscle can't hold up. So let's go into our stuff that we're actually here for. So we talked a little bit about assessing. So we do the 7 tests, find out the weaknesses and mobility issues within the kinetic chain. Once we find that, we go into our muscle testing, find out what's going on. Then we're going to our treatment. So today, specifically, our treatment is going to be instrument-assisted soft tissue mobilization. So step 1, assessment, movement testing, and muscle testing. Step 2 is going to be our instrument-assisted soft tissue mobilization. Then step 3, which will be after we talked about here, is going to be our corrective exercise work. So instrument-assisted soft tissue mobilization is a new form of treatment of fascia and connective tissue. A newly developed tool allows the therapist an extremely efficient way to locate functional disorders of the connective tissue and treat. Instrument-assisted soft tissue mobilization is carried out with an ergon-designed tool, ours is called the Blade, with the aid of fascial restrictions can be detected and treated. It allows for rapid localization treatment of fibrosis, chronic inflammation, and degeneration. The ergon design of the Blade allows the therapist to track their infusions and fashion to treat them with reasonable pressure and thrust techniques. So again, we actually only suggest about 6 to 8 pounds of pressure using this tool. So then our goal with this is not to create bruising, not to create petechiae, not to create redness and swelling. Our goal is very simple, just to create mobility within the tissues. So we're going to create that training of the control microtrauma in the affected tissues to stimulate local inflammation. Again, we're not actually healing or breaking down muscle mass or scar tissue. We're starting that process so the body can heal itself and the body can retrain itself. So a little bit more about fascia. This is a commonly talked about. So the fascia system has been termed by Gratz in 1938 as a functional joint because it provides strength, structure, extensibility, and flexibility all in one. It weaves itself through muscles, ligaments, and joints. Not only that, but nerves, head, brain, and organs. So this stuff is like saran wrap or sticky wrap. In our live course, we always take a piece of saran wrap and show it. Fascia wraps around the muscle. If we had adhesion to the fascia, it actually limits the blood flow, oxygen, nutrition that can go to that muscle, go to that area so the body can't heal and repair itself. It's just like if you take a piece of saran wrap and put it over top of your mouth, you won't be able to breathe. Muscles are the same way. So if you don't keep that fascia healthy and moving very well, it can actually cut off circulation and issues towards the muscles. So what is myofascial adhesion? So I'm going to go divert a little bit because myofascial adhesion is like, just like we talked about the slide before, is that saran wrap. If I take 2 pieces of saran wrap and stick them together, they're going to get stuck and crinkly and cause like dysfunction within the saran wrap. If I take those same 2 pieces of saran wrap and I put a little bit of water between it, they're not going to get stuck and be able to slide and glide. Everything within the human body must move. So again, our muscles must slide and glide over top of one another to create that mobility. For example, if we look at the lower extremity in the leg specifically, we have our vastus lateralis and our IT band. So when I go into knee flexion extension through walking, my IT band actually slides and glides over top of the vastus lateralis to help with that flexion extension and stability within the knee. Okay. If I have adhesions, it's going to, or those 2 tissues are stuck together and have a lot of friction, we're not going to have that great mobility, which is going to lead to a little bit of lateral pain. So a lot of people will try to foam roll and stretch, but again, when we go for the blade, we're actually going to go between those 2 tissues and create that mobility between the 2 tissues. Here's a great picture of a myofascial adhesion. So these are 2 tissues that are stuck together. That's you can see all the stickiness and everything through those tissues. So our goal is to create mobility and create more blood flow and get those tissues to slide back and forth over one another. So of course, how we fix this condition. So our whole purpose of this webinar today is instrument-assisted soft tissue mobilization. So when the tissue is damaged, it will heal in a disorganized pattern, forming scar tissue and adhesion. So if any kind of damage, not just blunt force trauma, but repetition, um, overuse, and just an unhealthy tissue is going to lead to this as well. When it is damaged, it will heal in a disorganized pattern, forming adhesions and scar tissue. These adhesions will lead to limitations in range of motion and increase in pain. So if I have a decrease in blood flow, circulation, nutrition to the area, I'm going to have a decrease in pain because we have that nociceptivity increases, which causes a decrease in mechanoreceptive activity. So these instruments and tools are used to aid in practitioners' ability to detect these adhesions as well as treat them. So then with the instrument, we actually use this as an assessment tool and a treatment tool. So how it actually works. So scar tissue adhesions prevent the fluid movement of muscle, tendon, ligament, and fascia. As the M2T-Blade instrument glides over the adhered tissues, the stainless steel tool will reverberate the feeling in our hands, like a stethoscope amplifies the sound of the heart. Instrument-assisted soft tissue mobilization tools will help us in finding the exact areas of restriction. They help us break down scar tissue, and over time, this process will eliminate or adhere fibers, restore function, and decrease in pain. So a little bit about the blade. If you don't have one of these, this is going to be just kind of like an outline here. So it's double beveled with both a superficial and deep treatment edge. So we actually have it cut at two different edges. We'll show that here. There's 8 treatment points. There's 8 treatment points to affect all areas of the body. So you don't need multiple tools. There's one tool. We find it very specifically. So again, each treatment point will work on each individual spot. We've integrated a handle for increased control and outcomes. Can be used in either hand. Made in Canada. It's made of what's called surgical grade stainless steel. So we use what's called 316 stainless steel, meaning that's a non-porous stainless steel. So if you're going from patient to patient, it's not going to trap dirt, debris, the patient. It's easy to clean. Just one swipe of a alcohol wipe cleans the blade. There's no need to sanitize or soak it for hours like a lot of other tools. We're about in, this map is actually a little bit outdated. We're in 50 countries now, so we've just opened up, we were in Myanmar we did the first certification in Myanmar last month, and we also done Malaysia and Singapore, which is not on there as well. So here's a picture of the blade. So these are all the treatment points. So from the bottom to the top, we have treatment edge number 1 and 2. So those are typically used for your assessing and your treating. Then we're going to go counterclockwise, and we'll see everything from 3, 4, 5, 6, 7, and 8. All those points will be used for specific areas of that we're treating. Now, we do have a handlebar that we use as well. That's more for on-site work. So if you're working on field placements or in the gym, you can go through those really nicely with that, and you use free hands. Typically, when we're going through our course, we always want to have one hand on the patient and one hand on the tool, so we have full control of our passive range of motion. And I just like this slide. I think this is one of our great master instructors, Kimmy. So she's going through just how M2T-Blade therapy, so myofascial adhesion therapy can help. So this is just a nice little break into all the stuff that we've given you. But it's a tool developed by chiropractors and fitness trainers to help reduce injuries, improve performance, provide ease in assessment, treatment of patients and clients, and increase blood flow, relaxation, and speed up recovery. The M2T-Blade therapy includes assessment, treatment, and corrective exercises and stretches. Common issues that we treat is Achilles tendonitis, tendinous and golf carpal tunnel, frozen shoulder, plantar fasciitis, scar tissue, wrenched knee, chronic low back pain, muscle and joint tightness, and nerve impingement. Yeah, this is a pretty cool picture. This is one of our great instructors out in Toronto. It's called the Toronto Body Mechanic. If you're on Instagram, follow him. He's got some really cool stuff. He's always kind of featuring the blade and how he treats it with pro athletes and all that stuff. So tissue assessment, let's go kind of break it down of what we talked about before. So your assessment should include global movement, range of motion, strength, and tissue quality. The FCP can use as part of your assessment to determine the tissue quality. So again, just a little bit about the assessment here. So we can use it for global movement testing, range of motion, muscle strength testing, soft tissue palpation, assessment with the M2T, treatment, retest, and corrective. How we use it to detect faulty tissues. So once the area has been narrowed down by the assessment, the entity is used to find specific areas of restriction. So just a little bit of a recap, you go through your full functional assessments, your squatting, your lunging, your push-ups, your hip hinge. Then you go into your range of motion and your muscle testing of the areas that you found are not working very well. Once you found those areas, you're going to really narrow down the restriction using the blade. So we use what's called a sweeping motion. So we're going to sweep the entity over the adhered tissues, and there'll be what's called a tactile feedback felt through the tool into the practitioner's hand. So it's like you're going over Rice Krispies or bumps underneath the skin where those adhesions are going to be. So once you found those adhesions, which is causing disruption in myofascial systems, disruption in muscles, we can go on to our treatments. So treating with the M2T, we use emollient cream or lotion. So we typically recommend a cocoa butter. It's easy glide, easy to get off the skin. We're also going to treat our tissues from superficial to deep. The M2T must always be held at a 45-degree angle to the targeted tissues. The M2T can be push or pull, which should only be used in one direction at a time. Only moderate pressure to the tool is needed to affect the tissues. If severe reddening of the patient's skin develops, it's usually a sign to move on. So we always typically recommend 30 to 40 seconds per area, or if you felt like those Rice Krispies or those bumps underneath the have dissipated or decreased, move on to the next area. We don't want to over-treat. We really want to just find the mobility issues and treat it till we have that decrease and we have that improved mobility. So there's 4 ways we can do it. So we can treat the tissue in a lengthened position, we can treat it in a shortened position, under load, and through active movement. There's one thing that always stays the same, no matter if we go within minus function. So we always treat in the direction that we feel the most myofascial adhesions, and that's called line of dysfunction. So typically with the, for example, the traps, the line of dysfunction is typically going up towards the occiput. So we're going to treat in that direction. So just like I talked about, so the M2T can be used in any direction. The practitioner must always assess the line dysfunction first prior to treatment. So we assess line dysfunction, we do our sweeping. So in a range of motion, our muscle testing, when we sweep the tissue, the direction I feel the most adhesions, we treat in that same direction. Last thing we're going to talk about here is our corrective. So we talked about the assessment, we talked about muscle testing, range of motion, how to actually treat, and now we're going to our correctives. Corrective is probably one of the most neglected but most needed to help really your patients move better, feel better, and get positive results out of their treatments. So just to review, so step 1, assessment, global to specific. Step 2, treatment with the M2T-Blade. Step 3, IASTM retraining. Step 4, retest. Step 5, we're into our correctives. So what is it? So what is IASTM retraining? So this is a technique to reestablish neurological firing pattern that muscle will experience with normal corrective rehab exercise without putting dynamic load or stress to the muscle or joint. After an injury or repetitive strain, the receptors in the muscle, ligaments, and tendons and fascia are altered and may send abnormal signals back to the brain and the spinal cord. So when a muscle or joint is injured, the movement may be impaired, which will increase the activity of nociceptors, which creates pain around the joint. So if I have an increase in nociceptive activity, I'm going to have a decrease in mechanoreceptive activity since joint movement is restricted. Isometric agonist antagonist retraining will increase mechanoreceptor activity, which will influence the nervous system at the spinal level and inhibit nociceptive activity. Hence why it feels better to move an injured area. So firing of blood flow and nutrition to the area. Where I perform isometric agonist antagonist retraining, we improve neurological response, prepare the tissues, and retrain muscle movement right away. How we do it. So just like the appropriate muscle testing, the practitioner and trainer will shorten the intended muscle while applying a perpendicular force that matches the strength of the tissue movement for 7 seconds. Once completed, the practitioner and trainer will perform the same technique to the antagonistic muscle. We'll repeat 3 to 5 times and we'll go into our strengthening. So thank you for joining our course today, or our online webinar today. I know there's a lot of information there, so we're going to spend a couple minutes. If you do have a question, feel free to put it in the box. I'll go through the questions in a few moments. Again, one thing we want to do offer you guys is we do have custom tools. You do get the colors, so you can see all the colors in the picture there, and you also get your name and stuff and your logo engraved on it. Here's a great picture of 2 tools we did out in, I think it's Wisconsin or the north. Yeah, it's one in the North States. So we put the logo and it looks really cool. This year you guys get 20% off that as well. And here's another one I go over for a hospital in Saudi Arabia. So if you do have any questions, put it in the chat box now. I'm going to go through those questions and see if we can answer anything for you guys. Okay, there doesn't have to be any questions here. So if you do, always feel free to email us at education@m2blade.com. We do have a cupping webinar that's coming up next week, Monday around 9 o'clock Eastern Standard Time as well. We would love to have you guys on it. Cupping is a new phenomenon that a lot of people are going on Facebook, Instagram, and going through it as well. So we hope to see you guys. Thanks for joining our webinar today. Have a great long Easter weekend.